It is a combination of my own research of 50 years and my experience. So the amblyopia, the strategy to achieve quality and stable vision. And just see, we have to think and rethink beyond targeting 6/6. These are something different for you and something new for you. I am going to tell you what is the difference. Over 100 years, in spite of trying different treatment regimes, amblyopia remains confused, unsolved, having a prevalence of 3 to 8% all over the world. 1.2% persons live with compromised visual related quality of life and being labeled as visually unfit for their specific jobs. Well, it is said that the management of amblyopia should be started when the head is born but the body is yet to be delivered. Is it possible? Yes. You know, the naming ceremony starts on 12th day onward. 12th day means Barso. On that day, this is a naming ceremony. On that day, if you keep 2 dolls over the cradle of the child, that will definitely help to develop the binocular reflexes also. And not only entertainment, but it will definitely try to help. The 2 amber colored dolls you can keep over the cradle of the child. Okay? These we call it as a Sandva or mother doll. Number 2, in all cases, whether it's a case of in all unilateral things, maybe cataract, maybe ptosis, or this is esotropia. Any unilateral things, they are not good. It should be always bilateral. So, if there is a central congenital cataract, maybe unilateral or bilateral, you can just do one thing. Put a drop of homatropine or cyclopentolate. In alternate day, even 1 drop is enough. Or in immature cases, children, you can dilute that particular drop and you can put it. But keep the pupil dilated and keep a flickering light over the cradle of the child till you perform the surgery of the cataract. So you have to utilize every day of critical period of life, that particular child, till you perform the surgery. Till you get a fitness of the child, physical fitness, anesthesia fitness, everything, or economic fitness. Till then you continue this regime if it is a central cataract. Dilate the pupil and it will definitely help to minimize the dense amblyopia, formation of dense amblyopia. And in same thing you can do in cases of ptosis. If it's a unilateral ptosis, if it's a bilateral, the child will look like this and you will try. There won't be any amblyopia. But in a unilateral case, you can put a small Tixo tape. You can see that. Put and keep the cornea moist and put a Tixo tape and put a flickering light over the child at least for 2-3 hours till that child sleeps. This will prevent. And after the age of 2 years, the child can be even, you can use a screen time, give him tab. This particular tab has a different types of exercises for the children and they can perform only after 2 years, only for 30 minutes at a time, not before 2 years, and can be repeated 3 to 6 times as per the severity of the amblyopia. The brightness should not be more than 60%. And in my tab, where it is a patented tab for the assessment and improvement of vision, if there is a auto shutdown mechanism which I have kept, after 30 minutes it will automatically shut down. So there won't be any problem for the child. Well, then another important point is that diagnosis at the earliest age is the problem with everybody. In all cases of strabismus or whether it's a isotropia, exotropia, in all cases I have told you just now that you have to see the fundus in detail to rule out the possibility of retinoblastoma and perform the refraction on the table. Yes, there are certain useful tricks for pre-verbal babies. You can just ask your computer person to prepare a Cat4 and allure drum, which I have shown you here. In these cases, just rotate those strips gradually and take that child towards those strips. You can find the optokinetic nystagmus, or you will find the difference in his face. That particular child will show you whether he is having some vision or not from his facial expressions also. At home also, that child is looking at a doll upstairs at the top of the roof of that room, and with a the measuring tape, you can measure how much is the distance from that eyes of that baby, and that is the vision of that child. These are the simple tricks. And especially to overcome the hospital phobia, usually the children from 2 to 3 years of age group, when they come to a doctor's office, they start immediately crying or, oh, I want to go back. And as soon as you show them something interesting, A for apple, E for elephant, like this, the child will immediately tell you, oh, doctor, I can tell you that is a, and you can continue. This is the best time to screen amblyopic babies, when they start learning A for apple and E for elephant. Now, these are the days of artificial intelligence. Now a blink vision scanner is also available for babies to find out the amblyopia problem. And another important thing is that why amblyopia disorder remains unsolved. The issue of compliance to patching regime resulting into unpredictable improvement and regression of visual acuity. Penalization medicines have limitations. Binocular active treatments are good options, but the problem of improvement of other visual function deficiencies is yet to be solved, which is the main cause of regression. Why the regression occurs? That I am going to tell you today. Are under trial, they are unaffordable and institutional based. Continuous changing concept needs rethinking and thinking. Again, there is a change in the definition of amblyopia. Amblyopia has been defined as a unilateral or sometimes bilateral reduction in best corrected visual acuity without a visible organic cause. But as per the recent advances, amblyopia is a binocular dysfunction. In fact, the major mechanism is not only the lazy state of the one eye, but the active inhibition of the amblyopic eye by the dominant eye, which disrupts the equilibrium between the excitatory and inhibitory signals. When you start patching the one eye, the other eye, the patched eye will not allow that other eye to develop. It is just like human tendency. Okay, they will not allow anybody to go ahead. Okay, the same thing happens here also. In anisometropia, even if the non-amblyopic eye has almost 6/6 vision, both the eyes have few more visual function deficits. As per current management of amblyopia favors binocular treatment for faster and fourfold improvement of visual acuity. Meridional amblyopia is sort of anisometropia. As there is a high difference between two meridians, one meridian remains chronically blurred. One of the most common and difficult variety of amblyopia to treat glasses correction alone or even with patching. This is one of my paper to treat chronically blurred meridian. Then again, passive versus active therapy, where the eyes and the person both are actively involved. That's why everybody is coming forward with binocular management and active management. There are so many people that are working on binocular management. You can use even a electronic spectacle envelope for the envelopes for alternate patching without any cosmetic problem. You can use a tab. And now the most important thing that I am going to tell you something different today. Why there is need of thinking and rethinking beyond targeting 6.6. Everybody is trying to increase that visual acuity up to 6.6. But both the eyes might have multiple visual function deficits apart from the deficit of visual acuity. Amblyopia is a disorder, is a syndrome or a plethora of so many deficiencies like crowding phenomena, reduced recognition of contrast objects, depth perception, positional uncertainty, and so many things. All the things, and just remember, if the contrast sensitivity or the stereo acuity does not improve along with visual acuity, the vision is going to, there will be a definite regression. So remember, all the things, there is a complementary faster route to achieve high level and stable vision. Playing specific video games enhances the improvement of recognition of contrast object and stereo vision. I think this is totally new for you. There are so many people, they have already started working, and I have worked already. My games will be available within a week's time. These are the simple games for contrast sensitivity. This circle will go on in moving, and the child has to tap a particular color, and these are the same color with different percentage, 100%, 60%, 30%. And why this is a, it's an interesting game also for the child to play, and this will definitely help to improve the contrast sensitivity, color contrast. Okay, these are all patented from my visual acuity assessment and improvement thing. So for stable vision, you have to try to improve the other visual function deficits also, then the acuity will automatically improve and it will be a stable and good quality, high level vision. So this is one of my book on amblyopia. You will find these all tricks and tips in that book, and these are the different games, and my tab, which is a patented tab, that also inaugurated by the President of American Academy. Thank you for giving much time, sufficient time. Thank you, Chairman Sir. Thank you. Audience.